Hello, my name is Amy Boldosser-Boesch, and it's been an honor for me to be a part of the 2025 North American WomenLift Health Cohort. And today I'm pleased to share my leadership project with you. I'm a passionate advocate for the rights of women and girls globally and domestically. I'm also the mom of a daughter who is already a budding advocate. I'm the Senior Director leading health policy, advocacy, and engagement at Management Sciences for Health, and I'm proud to serve as chair of the board of directors of the Global Health Council. I carry the words of Ruth Bader Ginsburg with me everywhere I go on my handy tote bag. Those words, women belong in all places where decisions are being made, are at the heart of my presentation today on increasing women's leadership on boards of directors, particularly in the nonprofit and global health space. Becoming a board director can enable women leaders to acquire and contribute strategic perspective and to cultivate important professional mentor relationships across sectors while honing governance skills. At the organizational level, research demonstrates that having women serving on boards of directors improves overall decision-making, and that increased gender diversity on boards can improve financial results while reducing operational risk, accelerating innovation, and is correlated with having more women leaders in the organization overall. Despite this, increasing representation of women on nonprofit boards remains a persistent challenge, and only 2% of nonprofit board seats are held by women from low-income countries. WomenLift Health challenges us to enable women to lead, not just participate. And the Global Health 50/50 report challenged those of us who are already in board service to use our voices to advance systemic change. I took on these challenges through my project with the goal of documenting barriers and enablers to increasing representation and meaningful participation of women, including women leaders from lower middle income countries, on global health related boards of directors. I conducted a desk review of existing research and policies and conducted key informant interviews and surveys with 9 women leaders serving on boards of directors. Today's presentation is the start of the next steps of the project to disseminate and shape board policies with my findings. Across the literature and interviews, a number of barriers emerged. Nominating and recruiting norms that favor high-income country and male-dominated networks or more established professionals disadvantage women, and especially young women, who are often overlooked despite being key stakeholders in long-term policy outcomes. Tokenism and superficial metrics without redistribution of power result in diversity existing on paper, but power remaining centralized, limiting meaningful influence, as is reflected in these 2 powerful quotes from my interviewees on the slide. Structural and logistic barriers such as obtaining visas and needing to travel to participate in board meetings are barriers in particular for women from LMICs. Women also experienced there being unequal, informal credibility standards, feeling that they were required to do more to prove their qualifications and to navigate unfamiliar legal, cultural, and governance norms, often without structured onboarding. Across interviews, it became clear that participation on boards was facilitated through being visible in mission-aligned work and through intentional sponsorship by other women leaders. Interviews underscored that women's access to board seats depends less on merit and more on who's willing to open the door for them. Intentional diversity efforts do open doors, but inclusive leadership must go beyond recruitment, with board chairs and CEOs being accountable for having the courage to redesign meetings, bylaws, and norms to shift board culture. Equity-focused board training programs can help to demystify governance, build confidence, and create pathways into board roles. And interviewees recommended the use of external firms and clear criteria to support independent, bias-aware recruitment processes and to provide safe feedback mechanisms that enable honest assessment without fear of retaliation. Unfortunately, during the project period, attacks on diversity, equity, and inclusion initiatives and global health organizations facing funding crises due to cuts to global health funding limited the availability of some board members for interviews and made my original plans for a more public dissemination event a challenge. I remain committed to leveraging my role as a woman board leader and sharing my more detailed findings, along with relevant policies from the Global Health 50/50 Workplace Policy Repository that could advance the recommendations from my research, both through thought leadership channels and directly with board leaders from other global health organizations, in order to advance commitments and practical steps to increase women's leadership on boards of directors. Allow me to close with a big thank you to the WomenLift Health team, to our donors, and to my wonderful cohort and journey buddy for giving me an expanded network of strong and compassionate women leaders at this crucial inflection point for global health and for my career. Thank you to my coach and mentor who pushed me on boundary setting at a time when so much was out of control and I was still trying to control it all. As a board leader myself, work on my project caused me to reflect and adapt the ways I work to foster meaningful participation of all board members, and especially reflect on how I can use my leadership to do more to support women leaders, young women leaders, and leaders from lower middle income countries to be present in all places where decisions are being made. Thank you.